into the chat box, please do that. And I see that everyone is doing it. Great, wonderful. Okay. And give it over to Nataki for some explanation on the meeting logistics.
Hi, everyone. Thanks again for joining the December monthly call. We hope the weather where you are is much better than the weather in DC. It's gloomy for us. Before we get started, just a few housekeeping rules and reminders for the new people who are joining this call. Of course, please mute reduce background noise. We are getting a little bit of interference right now, so please mute yourself. At the left of your name, there is a green phone icon, so please click on it. It'll turn red, strike through, and you will be on mute. If you are sharing a question or a comment, please feel free to unmute yourself. As I said before, this webinar is being recorded and will be made available to you with the slides. Also, thank you guys for joining us today. We do have a few new people on the call, and also I think we want to, also just want to say thank you, and we hope that you guys have a great holiday season.
Thanks, Nataki. Okay, so as Nataki said, we are lucky enough to have 2 new participants to our cohort. And I'd like to take a moment to introduce you to Sean and Monica, who will be working at Lake Forest Elementary School at their school-based health center and beyond. And so Monica and Sean, do you each want to take a moment to introduce yourselves? What you can do is I will unmute you. And you should be able to talk. So Monica, how about you? Let's start with you. Do you just want to say a few words about yourself and where you're coming from?
Can you hear me?
Can you hear me? You're having a bit of feedback.
Hang this one.
Oh yeah.
Okay, that better?
Yeah, thank you.
Okay, I'm Monica, and I work here at Lake Forest Elementary in Sandy Springs, Georgia, and I'm a behavioral health counselor. And prior to working here, I was a social worker at a residential treatment facility in Alabama with adolescents. And prior to that, I worked at a mental health center with adults in a community mental health center.
Great. Thank you so much. We're so excited to have you on board, Monica. How about you, Sean?
My time on your phone?
No.
Okay, sorry. Yeah, my name is Sean. I'm a health educator at Lake Forest. I started at health educator.
Go ahead. Sean, you cut out. We heard that you're working at Lake Forest as a health educator. Do you want to share anything else? Okay. Hopefully we'll be able to reconnect.
Okay, I'm sorry. I had some technical difficulties. Can you hear me now?
Do you want to share anything else about your background, Sean?
Okay, yeah, I was saying I'm a health educator here at Lake Forest. I started personal training, and then from there been a health educator through various companies. Graduated from Georgia State with the exercise science degree.
Wonderful. Well, thank you so much. We're looking forward to having you on board. Sorry, I'm clicking around a little bit here because I want to be able to show the bottom of my screen where it shows your name. I'm Monica Poole and Sean Thompson, and for some reason I was unable to do that. So half of your names are there, but we're really looking forward to having you as a part of the cohort and working internally in Georgia as well as across with all of these other wonderful colleagues to help the site. So we have some other great updates to share. across the cohort in addition to these introductions. So first of all, we wanted to thank Sapna and Kay for a great presentation last night. They presented to the District Health Council in Montgomery County, Maryland. So you can see some great pictures of active presentation and then spreading the word of Hallways to Health. So thanks to you ladies for that. We also want to acknowledge Bianca and your team here at JFK for your wonderful achievement and recognition within the Let's Move Active Schools initiative. So congratulations to your team. So those are really wonderful updates that we like to share at the beginning of the call. And I do want to let you know that we're going to be sharing a lot of information. So thinking about how to lifting up your work and through these awards and through these presentations and things like that is really what's driving this initiative. So thank you for all of that. I saw 2 more people hopped on the call. So hi, Renee from Rice hopped on the call. And someone's still calling in. Great. Okay. So our objectives for today are to identify the key elements of MOUs, policies, procedures, and job descriptions, describe the steps a site has taken to engage stakeholders and to create or update a policy, identify the policies, procedures, and protocols that your site will develop, and provide some project updates and information as well. So the beginning of our call will focus on providing information on the policies and protocols. So steps 1, objectives 1 through 3, and then we'll provide a little bit more detail about other training resources that we'll be providing to you in objective number 4. Okay, so to kick off this part of the call, we just wanted to revisit the objective that we have that by June 30th, 2017, 100% of Hallways to Health sites will submit written documentation of sustainable efforts, including policies, protocols, workflows, and practices in each of our 3 content areas: healthy eating, active living, social emotional health, and school employee wellness. Your work is really valuable, as we just talked about and have been talking about, and we're really excited to finish this initiative with writing down and documenting what you have done as a part of Hallways to Health to train other school-based health centers and help them replicate what you are doing in your centers. And so what we're going to have you do is draft policies and procedures due in April 17th, and then your final policies and procedures will be due by the date above. We'll spend a lot of time on our upcoming calls discussing and providing examples from your sites on policies and procedures, as well as some individual TA. Of the examples that we have found and we're going to be providing to you, many of the policies do not address student social and emotional health, so we want to make sure to ask you, if you see really great examples of those, to share them out with us as well so we can share them with each other. And we know that it is often difficult to change school policy or district level policy. So for our purposes, the policies that you can submit to us can be formal or they can be informal, and they can also include the curricula you write as well as kind of how-to guides. I see we have a few more people on the call, so just make sure that we're noting them down. Okay. As you see on the slide, a memorandum of understanding is a written agreement between a school-based health center, a school, and/or a medical sponsor or any other partner organizations. For your purposes, that will be a lot of the community organizations that you're working with to deliver some of your interventions, like the FIT Club that you have at Ray Elementary School, for instance. It describes shares and individual responsibilities, and they're spelled out clearly. The document also explains how to resolve problems and terminate the agreement if necessary. All of you probably have an MOU with your school. Whether or not it's something that you've been exposed to through your work at your school-based health center, you should be able to find it and take a look at it. The details of the agreement are then operationalized in documents known as policies and procedures. So that's where our work comes in. An MOU is essential to ensuring all of the involved parties have a clear understanding of their responsibilities, and we want to make sure that you are able to check what's included in your MOU with your school. For instance, although many of your MOUs probably include clinical service delivery, they may not include provision of obesity prevention and or social emotional health efforts which you've expanded and taken on as a result of Hallways to Health. Many of your sites have been doing screening for food insecurity, as well as the risk assessments which we did for social emotional health, or for social determinants of health, excuse me. So if you have expanded the services offered by your school-based health center that wasn't there before Hallways to Health, you want to make sure that the description of the MOU is comprehensive and complete and fully represents the current scope of your services and your delivery. And if it's not current, we want to make sure to update them, whether it's in the MOU or in the policies and procedures. You may also want to think about who you have MOUs with or who you need to have MOUs with. So as the slide here shows, the policies detail the what and the procedures detail the how. These are examples of clinical policies and procedures, but we're working to create policies and procedures that can both be applied within the clinic as well as within the coordination efforts that you are employing within Hallways to Health. So policies and procedures are documents. They can greatly contribute to the staff members' understanding of the expected procedures to be used across partner and staff members. Having these documented in detail reduces miscommunication and misunderstanding when implementing day-to-day work. Policies reflect the rules governing the implementation of the procedures, and the procedures outline how the school-based health center staff and your partners should be implementing those rules. Policies direct workers to take action consistent with legal, ethical, and organizational requirements and goals. And procedures provide explicit step-by-step instructions of how to do this. One of the things we're asking you to do in creating policies and procedures to document your Hallways to Health efforts is to take a look at your MOUs and your current policies and procedures, which you did as a part of the action planning process, and to update them and make sure that they're current. They should really evolve over time as new tools emerge, new processes are designed, and the risks associated with an area changes in response to internal or external environmental changes. So if, as a result of Hallways to Health, you've taken on screening for food insecurity in order to fully represent and actualize the needs of your school population, your outside community, you want to make sure that the policies and procedures are really in a place that reflects that need. And when a policy changes, you also need to go back and revisit the MOU to adapt that as necessary as well. So we've worked over the course of last year doing our action planning process to go through some of these steps, and I just want to provide a little bit of a review. We worked to determine the essential policies, so thinking about the rules and regulations federally at the state level and at the local level that are required to have a school wellness policy, a district wellness policy. I know that in each state those rules and regulations are different. We also know that the ESSA reauthorization is going to change what that will look like for each state and how that will be operationalized, so keep an eye on that. And then you want to review, again, the MOU to identify the policies necessary for execution. And as we did in our action planning process, identify the policies that are needed to do good business and provide the scope of services that help your school reach their vision and mission and help your school-based health center to do the same. So go check out your action plans. Do the policies that you looked at include family and community and school involvement? Do they include nutrition? Do they include physical activity or education? Do they include healthy and safe environment? Do they include social and emotional well-being? Many of the school policies we've seen do not. So take a look at those. Do they include any of the preventative health care services that you're offering? Or any of the staff wellness initiatives that you're covering? So go back to your action plans, check out tab 1 where you reviewed those policies, and see where the gaps are. The other thing you might want to think about is if your policies include anything on care coordination or referrals or wellness councils or committees or relationships of discipline to health and wellness and academic success. And when we go to write a policy, we want to make sure that we include measurable objectives and expectations, responsibilities, and compliance enforcement. So the steps to writing a policy are here. Of course, we want to understand what the organization's position is relative to the policy, and want to make sure that the policy unites everything that's required and addresses all of the potential concerns that any of your organizations might have, for instance, liability, etc. You want to share the draft of the policy for feedback with any of the appropriate parties and stakeholders, and then you want to work to finalize it. So this should be done, steps 1 and 2 are part of the planning and research, and steps 3 and 4 are sort of the latter steps. You want to think about who really will be implementing your policy. So if your policy is a workflow where you decide to screen every student in the school for food insecurity, let's say, or every student who comes into the clinic, and then you're going to do a warm handoff to your behavioral health counselor, you want to make sure that all the people who would be involved in that process approve of the policy and have signed off on it and have bought into it. I know I'm doing a lot of talking, but I think a lot of these pieces are familiar to you, but I just want to make sure that we repeat them so that we give you the tools that you need to create or update policies as necessary. So thank you for listening, and I'm sorry that there's so much talking. So again, we want to make sure when we write our policy that we include who's responsible for what, where the work is going to happen, detailed steps with instructions and duties, defining what's complete and what the performance expectations are, and any of the corresponding resources. So if there's a referral form that needs to be included or a consent form that needs to be included, that those be a part of the policy. Again, background research, identifying the problems and the current practices, which you've already been doing through your action planning, drafting the procedures, and then sharing the draft of the procedures for feedback with the appropriate parties and finalizing. So the same schema goes for writing a policy and writing a procedure, but they're just used differently. The policy is the what and the procedure is the how. Similarly, if you're working to establish a job description, which is something that many of you have created through Hallways to Health, whether it's been a school staff liaison to the school-based health center or a health educator or coordinator position, which you want to be expanded, or you want to be a part of Hallways to Health efforts moving forward, creating a job description which has a clear title, clearly delineates who the supervisor is, what the responsibilities are, and what the required education and experience are. These are really good guidelines to create something like that. I see we have a question in the chat box. I'm just going to pull that up. Great. Okay, awesome. So, especially since I just did so much talking, And I mentioned that we're going to provide a lot of examples of policies and resources. Beginning with this call, we want to invite a Hallways to Health site to share with us about some of their internal work. I'm now going to turn the mic over to Kylie Pybus at Milwaukee High School, who will share a presentation with us about stakeholder engagement and the role in the policy formation, in its role in policy formation at Milwaukee High School. And Kylie, you should be unmuted.
Hello, everyone. Is everybody seeing the screen okay?
We can.
I hope so. Just let me know if anything cuts out. So Jordana had asked me to share a little bit about a community agency partnership handbook that our school-based health center has created. As a district, we're really lucky to have strong partnerships with Wichita Family Support Center, which serves all schools through case management. They have a food pantry and different services available there. And a huge part of their success has been that they've been able to create these strong partnerships with other nonprofits in the community that serve youth and being able to provide that direct services directly through the district. So I wanted to start today just about, and what I know a lot of us are experts in already, but how to approach conversations with schools if we're from an outside agency, such as a school-based health center, and then what schools need to know about agencies. So we recognize that it's been very important for agencies to know that schools run on a school calendar. They need to be cognizant of days that are off, what a bell schedule looks like, that it's very much outside of clinical operations. They're not familiar with HIPAA and FERPA, and that schools might need help with what services look like when they're being given to students. And that also schools are frequently contacted by a lot of people in the community with concerns, and so it's so important that when we're approaching schools, we really have evidence-based practices and shared objectives and goals. Milwaukee High School and North Clackamas School District's success can be attributed to establishing liaisons between agencies and the school. So providing on-site resources such as office space and time with students and staff will increase the visibility and access to students needing these services. And I'll give an example of what this looks like within our school for providing dental hygiene services later. So again, and including what agencies need to know about schools are what schools prioritize. So they, Milwaukee High School is concerned about student safety. Shared goals include what Jordana touched on of making sure that we have a safe and inclusive environment that promotes wellness, that we're being realistic about supporting teachers' instructional time, knowing that administrators are very concerned about student achievement and test scores, and that we also have other details to work within policies and procedures of how we work with staff and what that looks like for adding additional responsibilities onto school staff and administrators. So as I mentioned earlier, we're really lucky to have a wealth of community partnerships within North Clackamas. Here's a flurry of logos of some of them that we work with. Outside In is our medical sponsor for the school-based health center. So we have our own MOUs that are developed and carefully planned to be able to support the school-based health center here. And then the example that I will share is with our neighborhood health center, who provides dental services throughout Milwaukee, Oregon. And we employ a dental hygienist who comes here every Wednesday to provide free cleanings to our students, which has been so important. So as we heard earlier, really the foundation of establishing a partnership is to recognize what's our mission as Outside In, as Milwaukee High School, what's the Neighborhood Health Center's mission, and how do those cross paths with each other so that we make sure that we're serving students in the best way. You can just read through Neighborhood Health Center's mission and how that closely aligns with some of our goals through Hallways to Health and as a school-based center. Some of the responsibilities of Neighborhood Health Center includes managing the dental hygienist. They also receive all of our referrals for further care if there are more concerning dental care practices that students need to receive. And then they also support our work with supplying dental hygiene and education. So Hallways to Health programming has allowed us to build on opportunities beyond just working with a dental hygienist to be able to present into classrooms. So Neighborhood Health Center has supplied more than 130 dental hygiene kits to supplement this programming. And in partnership with our dental hygienist, Kristen, myself and her go into our health classrooms and offer dental education as well as supplementing that with what good nutrition looks like. And these health services are being expanded within our policies and contract to make sure that this is a sustainable effort. So I'll leave you today with a few things that we think about, and really a lot of this information has been provided through our Social Services Director, Michael Rawls, which is housed in that Family Support Center. Our referral and consent forms are agency specific, and we have done this work to provide autonomy for multiple agencies that we work with. Developing a standard protocol for Neighborhood Health Center and other agencies that are integrated into the school is so important. And some tips for how this might start is by setting up just a first initial meeting, identifying those targets and goals of the partnership, and continuing to support this partnership with that agency liaison who should be offered an office spot and time within the school to increase visibility and success, and discussing what initiation of these services will look like. So policies and protocols should also include evaluation efforts for future planning and maintaining relationships with community agencies. So we make sure to update these MOUs as well as to maintain direct contact with these agency liaisons so that we can continue to improve our practices annually. And that's all I have for you today. If anybody has any questions, I'd be happy to talk about our partnership with Neighborhood Health Center and other agencies.
Thanks so much, Kylie. I want to give you an opportunity to have people ask questions. I just did want to really thank you. It's a great presentation and a great description of why it's important to engage stakeholders in this type of process, and how that also goes hand in hand with updating the policies and procedures. I really liked how you talked about your referral process, and especially since it's agency specific, talking about making sure that those are coordinated, and that with any policy and procedure and referral process that there's a component about evaluation as well, and you won't know that you've improved a practice unless you have that evaluation component in place. So does anyone have a question about how some of this coordination with some of these partners works at Milwaukee? Well, Kylie, I do have a question. I know that you're fairly new in the role, and so I just wanted to ask you if you can reflect on your first few weeks and sort of meeting the different stakeholders and different partners involved in the coordination of efforts for these dental services, and how that made you feel about your ability, your school-based health center's ability to provide the best service to your students.
Yeah, I've been amazed at the community investment that really is rooting for the success of the school-based health center. One thing that helped me with starting relationships with a lot of these community agencies is a monthly meeting that we hold so that every agency that has a contract or service through the district meets at our school-based health center on a Friday once a month, and so that's been great to kind of share common goals there. And then just knowing as a health and wellness coordinator, even though I have been new in the position, what expertise I can offer or services that I can offer to the agency liaison. And so when working with our dental hygienist, that really has looked like I'm the person that has the most contact with our school staff. And so I was able to offer the resources, being able to integrate into the health classes to be able to provide that further education.
Yeah, that sounds awesome. First of all, in the coordinated meeting with all the partners is an opportunity for regular exchange of information and sharing, and then everyone kind of having their own niche and knowing what that niche is and sharing it with others sounds like a really, really great model. I know that community partnerships play a different role in each of these school-based health centers that are part of Hallways to Health, and sometimes it might be more working with different agencies within the school as opposed to outside, but sounds like a really great model. Does anyone else have questions for Kylie? All right, thank you so much, Kylie.
Yeah, thank you.
Oh my gosh, so sorry. Can you read it to me? Can you read her? Yeah. The number.
It's 646-749.
And how do I do that? Okay, and we're back. Sorry about that, everyone. We just had some technical difficulties, so we're keeping on our toes. Again, thank you so much to Kylie. That was great, wonderful presentation about stakeholder engagement. And in the next few calls, we'll hear from Turner Elementary and we'll hear from Oakland Unified about the policies that they've already updated and put into place as a result of Hallways to Health and associated efforts. So just for the next section of our call, I want to provide some project updates. First, I'll provide a big update and introduction and informal launch of our sustainability platform. And then we'll talk a little bit about some upcoming deadlines and deliverables, the progress report, and an evaluation of this call. So just to remind you, we spoke a little bit earlier in the call about an action plan. And we're going to be hearing about a new kind of plan. So I just wanted to remind you that there are 3 types of plans. We had our programmatic action plan, which we had one for students. And you can see an example of the 3rd tab of that plan on the right. And then we had one for staff. And now we're going to begin also talking about a sustainability plan. So just to keep them separate, we're going to call that a work plan and keep talking about the programmatic action plans as programmatic and action plans. And when we look at the student plan, reminders that there are 3 tabs. The first one helped us assess what policies already exist. And I just want to add into that, as came up in this discussion today, if you have already reviewed nutrition policies and physical activity policies. You just want to make sure that you also go back and check if there is an MOU between your school and your school-based health center. So that's an additional thing to kind of look at. And this over here on the right is representing the final tab of the student action plan. And what we did is we used the data to develop these plans, which was rich and directly from your students, from your needs assessment. And then you use that to prioritize what you were going to be working at the clinical level, at the primary prevention level, and at the systems level. And the final policies and procedures which you'll be creating are a systemic representation of the work that you're doing at the clinic level and at the school-wide level. So this is what we've been working on all along in phase 2, and I just want to make sure that we come back to the same place that we started with these action plans and make sure that the work that you're doing, that the policies that you're creating goes and follows the work that you're doing at the clinic and at the primary prevention level in the areas that you've determined are the most priority for your students. So, over the last 4 years in Always to Health, an amazing 4 years, you have gone above and beyond the call of duty and successfully moved beyond the clinic walls in the delivery of obesity prevention and social emotional health for students and for school staff. Our funding will end in June. And in our final year of Hallways to Health, we have been tasked with thinking about how to sustain your innovative population health efforts, outputs, and outcomes. There are 2 parts to sustaining your work. It's going to sound a little bit like repetition, but in order to introduce the second part, we're going to talk to you a little bit about both parts as well. So part 1 is formally identifying and institutionalizing your efforts, making them official through the creation of written policies and protocols, the things we were just talking about. This is how you'll document your efforts, which you'll pass along, which will help you pass along your institutional knowledge to others at your site, as well as allowing us to share with the wider school-based health center field and helping replicate Hallways to Health efforts at other sites. The second part of the sustainability planning is planning for after the grant ends. This will define what sustainability looks like for Hallways to Health at your site and how to maintain the culture of health that you've begun to create. It will involve determining which relationships and resources are needed to continue with your efforts and determining at what level your work can continue with your current resources as well as with new resources and new relationships. We'll be providing you with additional training and resources on both pieces. As we mentioned, part of this will happen through our Learning Collaborative calls and presentations like the one Kylie just gave, as well as through a sustainability platform, which we will show you in a few minutes. So our objectives for sustainability are on the board, and we already spoke about the final objective, which is talking about creating written documentation of your sustainable Hallways to Health efforts. But the first 3 objectives are about developing sustainability work plans and documenting any funding strategies which have been created as a result of Hallways to Health. The goal is to complete the training on planning for sustainability, engaging stakeholders, and designing your sustainability work plan, and submitting a completed work plan to us by the end of the academic year. And just another reminder that although we're focusing on the policy piece here, and on the stakeholder engagement piece and developing a work plan, that we are always available to provide technical assistance to you on any clinical operation. So this is the really cool part, because I get to show you something that our senior database manager has created, and our consultant, Stacy Moody, and I have been working on. So the training consists of 4 modules, and eventually it'll consist of 5, and accompanying tools housed under each description So let's pause the screen so we can give you a tour. Okay, so this is the sustainability platform for Hallways to Health, and you'll be getting this information and instructions following the call. So we follow the link, and then we're going to use the password sustainability. Okay. And here you can see that there's going to be a description for the platform as a whole. So it says it includes a list of resources and tools to support the sustainability planning for Hallways to Health. Right now, the only module which you'll see is Module 1, but we'll be updating you and providing information when Modules 2, 3, and 4 are available. So within each module, you'll see that the topic is stated, so preparing for sustainability planning. And you'll see there's a presentation for each module, a description of the presentation, the slides that accompany the presentation, just in case you want to go back and look at any notes. You'll also see that there are titles of tools, and as you hover over the title of the tool, you'll get an explanation for each tool. You'll see a resource list, which explains all of the tools. And the state affiliates will also receive a state affiliate specific guide. You'll also see under each tool, in addition to the explanation, so let's check out the sustainability team roster. There's an example that's already filled in for you, so it can help you determine how to fill in your own. So here you can see that we would involve Sue Smith, who works at the School-Based Health Center, and her role would be as a health educator to own the sustainability planning. And we would also involve the development director at the health center itself in our sustainability planning team. You can see at the bottom there's a role for each of these people to play. And then there's a description below on what the sustainability team's tasks will include and a timeline for it. Again, further description can be found in the resources. And next to that, you'll also find a blank version of the same document. So this will be for you to complete by January 17th. So what you can do is on the top right corner, there's a place for you to download the tool. You can save it to your desktop and rename it. And then this is a fillable PDF form. So you can fill out your own sustainability team roster, talk about who will be involved in your sustainability efforts, and list out your tasks as well. You can see that there's also another tool, a vision statement tool with the same example and a blank template, an assessment tool which links you to an outside self-assessment that's on a website. And again, here we have the explanation. So the tool is created by the St. Louis Center for Public Health, George Warren Brown Social Work. And it's a 40-question assessment, and you'll see a link to the tool here, and a link to a tool which we went over at the Hallways to Health Midpoint meeting called the Message Box. So again, each module and its accompanying tools are housed under the description, and what we'll ask you to do is participate in the training according to the schedule that we'll talk about in a second. Rally your sustainability team together, watch each video, read the description of each tool, look at the example for each one, and then download and complete and submit each tool to us. I want to thank our amazing, he's not on the call, but our amazing senior database manager, Matt Even, for designing this really, really wonderful platform. I need to switch back to my slides. Does anyone, before I switch back to my slides, does anyone have any questions about the platform itself? Great. Feel free to unmute yourself by clicking on the phone icon. If you have a question about the platform, you can also type it in the chat box. Okay, so we'll ask you to use this information, and we'll be after the call sending you a PDF of all of the instructions for the modules. So we'll go over them now, but you'll again have this information to read. So here's the link and the password, and all of the materials can be submitted to me by the deadline. So just to give you an overview of what we're going to be looking at, Module 1 is Preparing for Sustainability Planning. So a lot of the work that you've already been doing, especially if you're in Maryland or in Oregon, Washington, and California and Georgia, you'll have a chance to get working on them as well. Module 2 is Engaging Stakeholders. And Module 3 is Designing and Implementing a Sustainability Plan. And Module 4 will be an overview of mid and long-term sustainability options. And Module 5, which I don't think you can see, is about Payment Reform 101, so just giving us some context. Okay. Again, in each module, we'll be working on separate objectives. So in the first module, we'll be talking about cultivating a strong foundation for development of a sustainability plan, and the subsequent modules will follow step by step, helping you to create those sustainability plans. And again, each of those will have a state affiliate guide. There was one quick question about whether this is the same sustainability training as the COIN. This is actually separate sustainability training that's designed specifically for Hallways to Health. I'm in thinking about your role as health educators and what you've done to expand population health efforts at your school, and the coordination work that you've done, the joint referrals work that you've done. So the idea is that you will be able to sustain some of these initiatives, which will hopefully help you become a more sustainable school-based health center and viable, but it does not specifically overlap with the 5 metrics which we've determined need to be captured in our sustainability COIN project here at the Alliance. So moving forward. And we will be sharing all of this information with you following the calls, including to you, Sarah. Okay. So just moving on. One of the other things that we'll be providing is a resource guide for policies and procedures. So in addition to the trainings that are focused on how do we sustain our efforts after we're done, going back to providing some sample wellness policies and templates, as well as districts which have really, really comprehensive school wellness policies, some toolkits and workbooks to help you develop policies that talk about wellness, some topics which you might not have considered for wellness policies, other self-assessments about policy, so a lot of tools and resources. There's no need for you to go and create your own versions of these things. You can use a lot of these templates as really wonderful guides. So what you'll do is look at the resources that we provide. So we'll be sending that in a PDF this afternoon as well, and that'll also be on the platform. Find appropriate templates that you like, read through them, check out which ones are applicable to your sites, and pick which one you want to use by January 17th so that you can have your draft to us by April and your final copies to us by July. And as you're working through sustainability, I'm sure there might be a lot of questions because this is new work for many of you. You've been working on Hallways to Health and kind of creating something as a pilot, but thinking about how to maintain it and sustain it will be new to you. So please feel free to reach out to myself or Stacy as we move forward. We'll come back to this in the end, but I thought this would be a good way to break up a little bit of our time and talk about our policy commitments. But I want to get through our other material first. So we're going to have, for the first time, an evaluation of this learning call. So just looking back at the objectives for the call, we will be asking if this call has met your needs. So this evaluation will be due by the end of the week, and it is available on Survey Gizmo, and we will follow up to the session with information about that evaluation. Another upcoming deliverable is the submission of the progress report. We have modified the format a little bit from last year's progress reports to reduce the amount of information that you need to write down. So hopefully it will take you less time. And I want to thank Sarah Geierstenger, who's on the call, who has really been wonderful at helping think about and how we can measure your progress and your advancement from the last quarter. So the progress report, will include what you've done since July, so thinking way back to the beginning of the year, and it'll ask what you've done in your action plan, if you've done anything on your sustainability work plan so far, and then for each of our focus areas, healthy eating, active living, social emotional health, and school employee wellness, it'll ask you to describe what you've done from July through December, and what you've done in the clinic level, as you can see in the top, and what you've done in the population level. And then there's some examples. So an example of something you might have done in the clinical level for healthy eating is you implemented a policy to allow school staff to receive acute and preventative care services. Or on the primary prevention level for school staff, you might have implemented a policy that school staff can be provided with on-campus exercise. So for each of the progress report categories, healthy eating, active living, social emotional, and staff wellness, there'll just be a box which you can answer. It says, has there been a policy implemented? How did you get to it? Is there written policy or documentation? If not, what's your next step to get one? And how likely is it that this activity or program will continue after the grant? It'll also ask you just if you have any other site-specific data on detention, suspension, graduation rate, and utilization. And just a reminder, our next learning call will be on January 10th, and we'll have an opportunity to hear from Oakland Unified about their policies. And then on January 17th, you'll have a few things due. The progress report, which I just spoke about. So both school-based health centers and state affiliates will have a version. You'll be required to complete Module 1, associated with the platform that we just showed you. So all of the tools, submitting all of the completed tools, and we're available for questions along the way. A review of the tools and resources for policies and procedures, as well as an invoice. Any questions? Okay. If not, then I would like to go back to this slide. And just get them a little involvement. Okay, we'll have to use this tool next time. Okay, we'll have to use this tool next time. But I will just call names and of those of you who are on, and I want to ask you to share one policy story or commitment that you have this year on healthy eating and active living. So let's go with Mary at Hope Clinic. Can you share one policy story or commitment that you have to healthy eating, active living?
Okay, hi, it's Mary. Sorry, I had to unmute. Oh, I'm sorry?
We can hear you.
Okay. In terms of, let's see, a policy, we don't, well, so we are organized a little bit differently, and our school district has established policies. So we don't create policies in the same way that you're speaking about them, but we do have protocols and procedures. And so in regard to that for healthy eating, what we did actually in our clinic was we implemented a policy that provided guidance to our providers to make sure that they interview all patients regarding food, the food insecurity questions, the two standardized questions, and so we added that to our interview questionnaire and as part of our face-to-face clinician exam. Is that what you're looking for?
Yeah, absolutely. Absolutely. So any new clinician who comes into your space presumably would get the same training that's part of your standard practice, correct?
Right.
Awesome. Yeah, that's definitely what we want to hear. That's great.
Oh, good. Yeah, I'm very excited about that. It's a simple thing, but it was necessary, and I'm pleased that we were able to do that.
Wonderful. Great. Any other commitments? Oh, sure. Okay, let's see. So how about if Elodia from Roosevelt or Gabby, you can share a commitment that you have on social or emotional health. I can unmute you.
Okay, that worked. So this is Elodia, and social and emotional health. So we have just recently finished our student wellness survey, and one of the things that we've added this year was we had the students fill out a quarter sheet saying that if they answered yes to certain questions, that if they wanted to speak with somebody to basically just check a box. And we actually had more students than we had anticipated check the box and have, in addition to running the CBITS groups and everything, the student wellness surveys, I think, have also regenerated sort of like a new topic of conversation and reaching out to both teachers and counselors and also our IBHC staff here in the clinic.
Wonderful. Do you envision that that you would keep that checkbox on for the following years, especially given the value of the demand for the request?
Right. So I think so. So we've been having a lot of conversations with the principal and the school climate person just to check in regularly, and the restorative justice person. And so as a team, I think we've decided that this has been more important than we had anticipated and also necessary definitely for the students. And so as part of the wellness, I think that we are going to continue using this not only this time in the fall, but potentially in the spring as well, and then continuing moving forward. I think this was sort of a learning process, and so we've decided that we're going to potentially change the wording of how we ask the question, because we had a lot of people just also coming in and saying, yes, I would like to speak someone like in general, but they weren't necessarily, they didn't necessarily think of like a specific thing related to the wellness survey. I think we need to like fine tune if there were specific instances that were coming up for the students that we may want to address differently, and basically it's, I think, serving to overall change the school climate and try and make it a more positive and welcoming.
Yeah, I really liked it, and the thought of like making it a deliberate connection from assessing the needs of the general population and to serving the needs of individual students, and as a result, the population as a whole. I think we often, kind of separate those two things. And in delivering the needs assessment, your school and district have committed and coming up and establishing this like really great wellness assessment, which is on Basecamp for everyone to take a look at, and that's unique to Roosevelt, but it's really, really great. Is that not only are you making a commitment to, in a biannual, in a semi-annual way, assess the needs of your population, but making sure that the student population is also aware of the school-based health center and the amount of, and the ability, like the access and ability that the students have to it, and awareness of it. So that's really incredible. I wonder if other sites can incorporate something like that. I know Washington Middle School, Mandy is in transit to our Leadership Fellows learning session, but they do the school counselor does an assessment at the beginning of every year, and I wonder if we might be able to suggest to them, based on how successful this has been for you and your students, to include a box at the end that says, do you want counseling on any of the above?
Yeah. I mean, as an aside, it actually wasn't a box within that we separated. It was like de-identified. So we had the survey run like on a different program, and then we literally made quarter sheets, and we had the students write their name, their date of birth, and if they answered yes to certain questions, and they would circle that, and then they would say, like, do you want to talk to somebody? Yes, and there was a space. And several like names of the key persons that they may want to speak to, and then a space for the students to write in. And so it was separate, right, so that we weren't necessarily seeing all of we just wanted to maintain confidentiality and so allow for the students to have their say within the survey, but then also allow for the students to fill out this sheet, this quarter sheet, which again I feel like has been amazing to see the response. I mean, this happened more than a month ago, and we're still seeing referrals because of that.
Wow, that's really great. Well, I mean, I know it's just a quarter sheet of paper, but would you be able to send a PDF and like kind of how you utilized it to ask so we can post on Basecamp?
Sure. I do, with the caveat that I do think it needs tweaking. I mean, it was like the first pass, but I think the wording, maybe some of the wording needs to change a little bit. But yeah, I would be happy to send a PDF.
That'd be great. Thank you so much. Okay, great. And let's go to, let's see, Renee, how about you at Rice? Do you want to talk about one policy story or commitment that you have for your school staff this year? Does anyone want to share a story that they have from their school staff for this year? Can be anyone on this call.
Hello? Hello?
We can hear you.
Oh, okay. This is Renee.
Hi, Renee.
Hi. So we are currently doing monthly emails to staff for, we do Wellness Wednesday. So I was going into the teacher's lounge and doing like an activity with them and a healthy food demo. And right now we're just working on just sending them, doing an email blast. We've also done, we did a clinic tour with them earlier this year so that all of the new staff would be able to see the clinic and hear about our services. During Parent-Teacher Conference Week, we sent little bags with like resources and information on clinic services to all the teachers. So if during a parent-teacher conference they identified a need, that they could just provide that to the family. And then we also did a presentation on clinic services to staff at a staff meeting.
That's great. Is that a type of thing that you would want to see happen annually?
Mm-hmm. Yeah, so that's what we've been doing annually since we started.
Great. Wonderful. As a part of your clinic operations, obviously that's not something you would include in your SBHC kind of MOU with the school, but it might be something you might want to include in like an operations manual or in a best practice. So even writing up something like that, that every new school-based health center staff is required to attend a teacher orientation or to do one welcoming event at the beginning of each year or at the beginning of each semester, is also like a policy light that we would definitely want to see included as part of the final write-ups for Holidays to Health, if that makes sense. So it doesn't necessarily need to be something complicated. It's kind of the bottom line.
Okay.
Wonderful. Well, I think we could share so many more examples, but that was a really, really great discussion for today, and I know we shared a lot of information, so we want to thank you. And again, we'll be sending out after the call the slides to the call, as well as links to the instructions for the sustainability platform and the resources that we spoke about there, in addition to the progress report template and the invoice template. So without further ado, we will conclude this call, and wanted to wish you a happy holiday. Thanks so much.